Most people believe that strokes happen without warning. One moment, everything is normal, and the next, life changes forever. Here's what nobody tells you. In many cases, the body tries to send signals long before a major stroke occurs. The problem is that these signals are often subtle, temporary, or easy to dismiss. A brief moment of dizziness, a sudden difficulty finding words, a strange numbness that disappears after a few minutes. Most people brush these experiences aside. They blame fatigue, stress, aging, a busy day. And sometimes that's exactly what those symptoms are, but sometimes they're not. Sometimes they're your body's way of asking for attention before something far more serious develops. After more than 25 years of caring for patients, I've learned that the warning signs we ignore often become the health problems we wish we had taken seriously. Today's conversation may help you recognize what your body could be trying to tell you before a stroke occurs.
My name is Dr. Michael Anderson, and I'm an internal medicine physician. Over the past quarter-century, I've cared for thousands of patients dealing with cardiovascular disease, high blood pressure, diabetes, and stroke-related conditions. I've witnessed the devastating impact strokes can have on individuals and families. But I've also seen something incredibly encouraging. Many strokes are preceded by risk factors and warning signs that, when recognized early, create opportunities for prevention. That's why this topic matters so much. Not to create fear, not to cause anxiety, but to encourage awareness. Because awareness often creates options, and options can change outcomes. Before we discuss the warning signs, let's understand what a stroke actually is. Imagine your brain as a thriving city. Every neighborhood depends on roads delivering supplies. In your body, those roads are blood vessels, and the supplies are oxygen and nutrients carried by blood.
A stroke occurs when part of the brain suddenly loses its blood supply, or when a blood vessel in the brain becomes damaged. Without oxygen, brain cells begin to struggle. The longer this continues, the greater the risk of lasting damage. That's why recognizing potential warning signs and managing risk factors can be so important. The first warning sign is temporary numbness or weakness. This is one of the most commonly overlooked symptoms I encounter. Many people assume they've simply slept in an awkward position or strained a muscle. And to be fair, sometimes that's true. Temporary numbness can have harmless explanations. But here's the hidden concern. When numbness or weakness suddenly affects one side of the body, even briefly, it deserves attention. What happens inside the body is that blood flow to a specific area of the brain may be interrupted temporarily. The symptom may disappear within minutes, making it easy to ignore. I once cared for a gentleman who experienced a brief period of weakness in his right arm while reading the newspaper. It lasted less than 10 minutes and resolved completely. He almost didn't mention it. Fortunately, he did. Further evaluation revealed significant stroke risk factors that required immediate attention. Were you aware that a symptom lasting only a few minutes could still be important? But that's only part of the story. The second warning sign involves sudden difficulty speaking or understanding language. Many people dismiss these episodes because they pass quickly. They may stumble over words, struggle to find the right phrase, or briefly have trouble understanding a conversation. The positive perception is that everyone occasionally forgets words. That's perfectly normal. The hidden risk is when the change is sudden and unusual for that individual. I remember a retired teacher who briefly found herself unable to finish a sentence during a conversation with her daughter.
Within minutes, everything seemed normal again. She considered ignoring it. Thankfully, her daughter encouraged her to seek medical attention. The episode turned out to be an important warning sign. Have you ever experienced a moment where words seemed unexpectedly difficult to find? The third sign may surprise you: sudden vision changes. Most people associate vision problems with aging eyes, needing stronger glasses, or spending too much time looking at screens.
and many vision changes are completely unrelated to stroke risk. However, sudden vision loss, blurred vision, or changes affecting one eye can sometimes signal a problem involving blood flow. Here's where things become interesting. The eyes and brain are closely connected. Changes in blood supply affecting the brain can sometimes appear first through vision symptoms. I recall a patient who described a brief curtain-like shadow over part of her vision. It resolved quickly. No pain, no obvious symptoms afterward.
Yet it provided an important clue that allowed us to identify underlying vascular issues. What surprised you most about that possibility? The fourth warning sign is dizziness or loss of balance. This one can be particularly challenging because dizziness has many possible causes. Dehydration, inner ear problems, medication side effects, and even standing up too quickly can contribute. That's why context matters. The concern increases when dizziness appears suddenly, feels severe, or occurs alongside other neurological symptoms. One patient described it as feeling as though the room suddenly shifted beneath him. He wasn't sure what had happened. Fortunately, he sought medical attention quickly. What happened next surprised even him. We discovered that several stroke risk factors had gone untreated for years. Were you aware that balance problems can sometimes provide important information about brain health? Now let's discuss something that often gets overlooked entirely: transient ischemic attacks, sometimes called TIAs. Many people have never heard of them. Others refer to them as mini-strokes. The positive news is that symptoms often resolve completely, but the hidden danger is that a TIA can serve as a serious warning sign. It's essentially the body's way of saying something needs attention. Symptoms may last only minutes, no pain, no lasting effects, yet the risk of a future stroke can be significantly higher afterward. Throughout my career, some of the most preventable strokes I've encountered occurred after warning signs that were dismissed because they disappeared. Here's where I want to shift our focus slightly. Sometimes the most important signals are not symptoms at all. They're risk factors. High blood pressure is one of the most significant examples. I've met countless patients who felt perfectly healthy while living with dangerously elevated blood pressure. No warning, no discomfort, no obvious symptoms. Yet, over time, uncontrolled blood pressure places tremendous stress on blood vessels throughout the body, including those supplying the brain. The same is true for diabetes, smoking, high cholesterol, physical inactivity, and certain heart conditions. The body may not always provide dramatic symptoms. Sometimes, prevention begins with recognizing risks rather than waiting for warnings. I remember a patient named Robert, a 72-year-old grandfather who came to my office for a routine examination. He felt healthy, active, independent. He rarely missed a day of gardening. During his visit, we discovered significantly elevated blood pressure and several other cardiovascular risk factors. He was surprised because he felt fine. Together, we developed a practical plan involving medication, lifestyle changes, and regular monitoring. A few years later, he told me something I'll never forget. Doctor, I didn't realize feeling healthy and being healthy weren't always the same thing. That lesson stayed with me because it highlights the silent nature of many stroke risk factors. Now let's talk about what you can do. First, know your numbers. Understand your blood pressure, cholesterol levels, and blood sugar status. Second, pay attention to unusual neurological symptoms, even if they seem brief. Third, maintain regular communication with your healthcare provider. Fourth, prioritize movement, balanced nutrition, quality sleep, and smoking cessation if applicable. These steps may sound simple, but simple habits often have powerful effects when repeated consistently over time. It's also worth asking yourself a few questions. When was the last time you checked your blood pressure? Do you know your cardiovascular risk factors?
Have you experienced any unusual symptoms that you dismissed because they disappeared quickly?
Are there lifestyle habits you could improve today rather than waiting until tomorrow?
One of the most inspiring stories from my career involved a woman named Margaret. She was 68 years old and experienced a brief episode of slurred speech while talking with a friend. The symptom lasted less than 5 minutes. By the time she arrived at the clinic, she felt completely normal. Many people would have ignored it. Instead, she chose to get evaluated. Further testing revealed significant narrowing in one of the arteries supplying blood to her brain. Together, we developed a treatment plan that included medication, lifestyle improvements, and careful follow-up. Years later, she remained active, independent, and deeply grateful that she listened to her body. Her story reminds us that prevention isn't about perfection. It's about paying attention when something doesn't feel right. If there is one lesson I hope you remember today, it is this: your body often whispers before it screams.
Small warning signs, temporary symptoms, and hidden risk factors may provide opportunities to act before a major health event occurs. Awareness does not guarantee prevention, but it often creates the chance to make better decisions, ask important questions, and seek appropriate care. Today we've discussed several signals that may deserve attention, including sudden weakness, numbness, speech difficulties, vision changes, balance problems, and transient neurological symptoms. We've also explored the importance of recognizing silent risk factors such as high blood pressure and diabetes. The goal is not to live in fear of every symptom. The goal is to become an informed observer of your own health. I'd love to hear from you. Before watching this video, were you familiar with any of these warning signs? Which one surprised you the most? Share your thoughts in the comments below. Your experience could encourage someone else to pay closer attention to their health. Thank you for spending this time with me. Stay informed, stay proactive, and remember, some of the most important health decisions are made long before an emergency ever occurs. Awareness today may help protect your tomorrow.